Hey guys, today I want to talk about why chiropractic care works really well for an overuse gym injury. Okay, so to differentiate the different types of pain that we can be in, the two most common is something called inflammatory, which is what happens after like an acute trauma, like a car accident or a bad slip or a fall right down the stairs or something very traumatic. And the other type of an injury is something called an overuse injury. And an overuse injury is exactly that. It's from something that we do over and over without enough, rest time in between, so that the muscle and the tissue essentially becomes overused. It's something that we do all day long, possibly like sitting too long or standing too long, bad desk ergonomics, that wears the body down over time, and we end up stiff and tight and just we feel like we can't move very well, and then we end up in pain because of that. So an overuse injury is also called ischemic. What that means is this: because of that wear and tear in our system, our muscles get too tight and our joints get all jammed up. And when this happens, we have a loss of mobility, and that's that stiff feeling that we get when we're just like, God, I wake up in the morning and I feel like I can't move very well. I can't bend forward. I can't touch my toes. I can't, twist around. So when this happens, and really common, it happens a lot with my athletes that are coming from some sort of an overuse injury in the gym, as well as a lot of desk workers from sitting too much at their computer. They have become stuck, too stiff, too tight, and as a result, there's less blood flow. And when there is less blood flow, we don't heal very well, and that's where the ischemic part is. Ischemia just means that we're not, we don't have very good blood flow. So the reason why chiropractic care works so incredibly well for that is literally everything that we do in this office is designed around helping our patients move better. From the chiropractic adjustment, the spinal manipulation, I am physically trying to help these joints that are not moving, help them move better. That's on like the microscopic, the micro scale, as well as, some muscle work to get the muscles to loosen up, right? But we always combine that with some sort of exercise. And exercise works on the global macro scale. So I'm gonna help the joints and the muscles move better, but then you're gonna work with our trainer and pick up maybe a kettlebell or do some air squats so that we get the entire body moving a little bit more than we did before, and that increases blood flow, increases mobility, and helps kick that overuse gym injury. All right. Number one thing that I always tell all my patients is to go outside and, anytime you hurt, go for a short little walk. Get the blood pumping. That helps with the ischemia, and it helps us recover from our overuse pain. All right. If you have any questions, just send them our way. Always remember to live with passion, not pain.